Welcome back. Well, today I am joined by Dr. Jacoub, and he is here on behalf of MemorialCare Saddleback Medical Center. Well, welcome. Very nice to have you on.
Thank you. It's nice to be here.
Thank you for joining us. I know you guys are always very busy, and especially not only as a medical oncologist, but also a medical director. So I'm sure it's very difficult to pull yourself away, but thank you.
Thank you. This is important, and I'm glad to be here to discuss the various topics you're interested in.
Okay, good. So before we get to really what the medical center does,
Sure.
The Cancer Institute, tell me a little bit about yourself and how you arrived here.
So, as you mentioned, I'm a medical oncologist and hematologist, so I take care of blood diseases and cancer. And I've been in this community since '06, so basically out of school, out of training. For the past couple of years, I've been the medical director for Orange County Oncology Services for MemorialCare. Mm-hmm. Prior to that, for about a decade, I was in private practice, and we had a rather large private practice in Orange County that was caring for probably maybe 1,500 to 2,000 new patients with cancer every year.
Okay.
That practice was acquired by the hospital system, as we've done others as well in Orange County, and really built a very large, comprehensive network of cancer-related services that really spans, honestly, from LA all the way to South Orange County.
Right,
yeah.
Right. Now let's talk a little bit about the Cancer Center itself. So you have the Saddleback Medical Center and then the Orange Coast Medical Center. Mm-hmm. So what are the differences?
So, and in addition, we also have Long Beach Memorial Medical Center. Each have their own respective cancer programs that fall under a larger sort of umbrella of a cancer program or cancer service line, and each may have some strengths. So we are trying to operate cohesively where those strengths are supported and further nourished to grow, and other areas that maybe not as strong would be sort of less so. So in the case of Saddleback, there's a lot of strengths with our surgical services, our breast program, mm-hmm. Our genetics program, a clinical research program that we are developing and have a whole host of different clinical trials available. Mm-hmm. Our what we would say maybe a supportive care or sort of ancillary services that include something like patient navigation, where you kind of take people through this labyrinth that is cancer care in the U.S. And try to basically take out some of the most stressful points that patients are experiencing, scheduling visits and understanding various things. And so Saddleback happens to be very strong in all of those areas, and they're continuing to sort of improve and enhance them.
Okay. So now, even off camera, we were talking about how cancer has increased in a number of people of all ages, and one key thing is prevention. Yeah. And you want to make sure you keep with your doctor visits and your mammograms and your prostate exams and things like that to help check for things.
Yeah, I agree. I think perhaps the viewers, I think at this point, hopefully have that sense of importance to those kinds of things. What I like to tell people when it comes to screening studies, hey, they're not the most pleasant thing. A colonoscopy is not that easy to do, but it's a lot about self-respect. Okay. If you respect yourself and your health, and you want to do right by yourself, get your screening studies done. The things are in your control are those screening studies and making those appointments, not smoking, not drinking or minimizing drinking, trying to stay slim and trim, exercising, watching your diet. Those are the things that are in your control. Your genes and the other things that give rise to diseases, those aren't. But it rarely is just one issue, your genes. It's usually an interplay of a lot of those factors. And so control the factors that you can.
That's a really nice way to put it, is self-respect, because I don't think I've actually heard anybody say that specific couple of words. Because you're right, if you respect your body and you respect what you put in your body, you may help prevent having something happen. Right. That's a really good point. So now let's talk about prevention. You have a event that's going to be coming up here, Laguna Woods Village. It's actually going to be for the residents. It's going to be at Moulton Parkway at Clubhouse 2. And I love it. So it's a few weeks away, but what is it you want to tell people about that event, and what will be some of the things that would be covered?
Well, we're bringing together a lot of the physicians that are involved in the various aspects of cancer care and prevention, things like that. So come out and meet them, hear what they have to say. The areas of prevention that we have evidence-based screening studies, from breast cancer to lung cancer to colorectal cancer, prostate cancer, those are things that will be highlighted, and there's reasons why we have screening studies for those. Among them is that these are the most common cancers. And cancer in general increases with age. 1 in 3 will have cancer by the time they're 80. And come and learn as much as you can about it, because I think education and knowledge is very helpful.
I was going to ask, now, when you say 1 in 3 will have some sort of cancer, is that including skin cancer?
It's including skin cancer as well.
Okay, because I was going to say that's very common.
That's very common, and and especially as we get older, and especially in Orange County. I mean, we're blessed with all the sun that we have, and the lifestyle that we all share. But there's consequence to that, and skin cancer is very common.
And it's something that we probably did to ourselves very early on if we've lived in the sun all of our lives, and sometimes it doesn't show up until later.
That's correct.
Right. Okay. Excellent. So I like the fact that you're going to bring a different doctor from each area. So they'll have talks, and then they'll have a Q&A, I assume?
Yes.
Okay.
Just
great.
like yeah.
Great.
So come with your questions.
Good. Now, would you agree that it is harder to get men into their regular appointments than women?
I wouldn't necessarily agree to that, just based on my own personal experience.
All right.
But perhaps there's data that supports that. But what I have noticed is there is a high level of motivation in South Orange County. It's demographically more, I would say, has more access. And there's definitely a higher level of education here. People are interested in their health, their lifestyles. They're into prevention and all those things, and it's really a privilege to practice in South Orange County, very honestly. But we hopefully just want to improve that if we could.
Excellent, excellent. If you were going to give our residents one piece of advice, what would you say?
I would say that learn as much as you can about your health.
Perfect. And have self-respect.
And have self-respect.
Thank you so
Always.
much. It was very nice to meet you, and
Thank you.
Glad to have you on.
Thank you. Thank you.
If you want more information about anything that we've discussed, including cancer research or cancer treatments, or maybe just the event that is coming up here on March 27th, you can go to memorialcare.org/SB Cancer. We'll be right back.